Hi, Stephanie.
Hi.
I'm going to ask you a few things about your experience with the treatment that you have done. So would you please tell me, first of all, what's your name and what do you do?
Sure. My name is Stephanie Marcy. I am a third-year medical student at Kansas City University of Medicine and Biosciences. Just a little history or background on me. For all my life, as far back as early childhood, as far back as I can remember, I've always had pain. I've had severe bruxism, headaches, jaw pain, jaw weakness and fatigue, neck pain, back pain, and ear pain, and I just thought that was normal, going through my life, and I sought consult about a month before I attended medical school, and was diagnosed with TMD, and I didn't have time to see someone there, and so whenever we moved to Kansas City, I kind of put it off, because whenever I started reading about TMD, I read, there's nothing really you can do, there's no real treatment that works, and that, if you just wear a mouth guard or whatnot, it'll go away over time. And that's not at all what I found.
Did you also hear the real reason is psychosocial or something?
Oh yeah, and I heard it was mainly a psychosocial or neurological basis, and so I just assumed, hey, whatever, I'm crazy, or I'm just so stressed out I can't deal with things. And so I put it off and put it off, and my symptoms were getting worse. And finally my husband, Ben, he got online, he started doing research as well. He started looking at research articles in evidence-based medicine as well, and saw the same things, but whenever he was seeking help, he found Dr. Rahman, and he was in Kansas City. And so we just decided, hey, let's see this guy, and let's see if we can do anything else besides nothing, or besides just heavily medicating myself for the rest of my life. And so whenever we first started seeing Dr. Rahman, he's like, yeah, I can help you. And we read through multiple testimonies of people that had gone to him. And so after going through the process, we've been with him now, it's almost been exactly 2 years now.
Remember, so that because it's going to be being taped, what was the first thing we did? Did we come to the conclusion you're going to need a bunch of porcelain?
No.
Okay.
We didn't even go down the road. Like, I didn't even care about, the way my teeth looked as a #1 cause. I had so much pain, and I was just constantly fatigued that I just, I couldn't get over it. And my #1, issue was my jaw pain, and then my neck pain, and then the headaches, and then the lower back pain, and then finally it was, well, you know what, my teeth are midget size. I don't like that. But that was definitely not my #1 concern. Now, I just want to say for the record, I'm not being paid to say this, and I'm not going to put my personal opinion on the line, if I think it's fabricated or not real at all. So I'm being honest here. So I just want you guys to know that my whole thought whenever I read this, and let me quote this.
And you're reading
I'm reading the AADR TMD policy statement revision approved by the AADR Council 3/3/2010. Quote, studies of the natural history of many TMDs suggest that they tend to improve or resolve over time. And, from one professional to the other in the medical field, I just think that's absolutely absurd. In my osteopathic training, we learn that structure and function are intricately related. And anyone with even a basic understanding of, gross anatomy could see that things are related. So why couldn't you just treat the problem, is my actual question to you guys. I really feel that you as dentists do a lot to help alleviate pain and so forth in other areas and avenues, but you actually have an opportunity here to fix people's pain in this regard that nobody else can. And I really urge you from the bottom of my heart to really seek further studies if you want, but don't go based on this evidence base that says that they tend to resolve over time. I'm a prime example of someone who did not. And I can tell you now today, I don't have headaches. I still have stress. I'm in a stressful, situation, but you know what? I don't even grind my teeth. I did all the time. It was constant grinding of my teeth. I don't do that anymore. I don't have the neck pain, the back pain, the fatigue. I don't have the ear pain that nobody could diagnose. You know, I thought I had chronic ear infections, and I didn't. And these are things that I really urge you guys to take seriously, because you have an integral part in changing the way that you practice medicine in the future. So please take this seriously. And as a medical professional, you know, future physician, I'm putting my professional opinion on the line. And if you have any questions, comments, or concerns, you know, feel free to contact Dr. Ramos so you can get a hold of me, because I will definitely tell you the same thing I'm telling you now. Thank you.
So how do you really feel? So what do you feel about that particular statement in a nutshell?
In my, you know, outside professionalism walls,
Just as a person.
I just think it's naive. I think it's absolutely naive. Like, from my training that I've gotten, structure and function are intricately related. You either fix the problem functionally, or you've got a structural issue that you need to correct, okay? And just saying that, okay, well, if you've got a structural issue that you need to correct, it's just going to spontaneously resolve. Like, you know, come on. I think that's elementary. I mean, anybody can tell you that that doesn't really make sense.
Okay. One of the other parts of this whole issue about ADR is the value they feel is useless to do the neuromuscular testing, like measuring the EMGs and all those other things. That whole idea, or for that matter, relaxing the muscles, that whole neuromuscular protocol, they really were completely opposed to it. They did their very best to actually squash it. What is your sense of knowing what you know about what we put you through in terms of the testing, and also we explain all of those to you? What is your understanding, and then how would be a reaction to their conclusion this is of no value at all?
Oh, well, I guess, you know, in my personal opinion, I think that, you know, just looking on the outside and looking on the situation without ever having done the neuromuscular testing, I would have been like, yeah, that's not going to work. But after actually going through it, there is only so much that you could do, you know, with, you know, trying to guesstimate with your eye value of where your alignment should be and what it should look like. But what I found with the neuromuscular testing and so forth and the relaxation is that we were able to get a lot better bite. I noticed the difference if we were just kind of pinpointing it with our eyes and trying to adjust and fine-tune that way, versus if I went through the whole gamut of, you know, the electrodes and the stimulation and so forth, I was able to relax a lot better and get a much better bite and figure out where I was most stable versus just making a random guess.
And then just for, again, because for record, we did something reversible first. How long do you remember?
What's that?
We did something reversible, meaning we changed the bite first. Only after 90 days you had significant improvement did we even talk about what might we do long term.
Oh, you mean, yeah, before we even talked about, yeah, okay. What we did initially is I was trying to build up the bottom teeth so that we could actually find a stable point where my jaw liked to be. I ground down my teeth so much that I actually needed to have something built back up to where they would normally be. And whenever we did that, that's whenever I started feeling so much better. The headaches started going away. Like, I stopped grinding my teeth, you know, the back aches and the fatigue, and that all stopped at that point. And, you know, after years of pain, I never realized what it was like to be a real person, I guess, without pain. And whenever I figured that out, I was like, I'm never going back to that. And, you know, Raman actually suggested that we don't have to necessarily do the full mouth reconstruction. We don't have to go down that avenue. And that wasn't my main concern in the beginning, but once I found out that we could actually do something about it, I was like all for it. So,
because psychosocial and stress is so much talked about as the cause of it, so now that you're going through all of this, how stress-free are you in your life?
I'm not stress-free. I've never been stress-free in my life. However, not having pain is a lot less stress on me.
True. But I guess my point is you are at third year medical student.
I'm a third year. I'm in the height of my, you know, stress load. Actually, when this whole process was going on, even before, you know, we'd had like the full mouth reconstruction and so forth, I was in the prime point of my life of stress. And I was taking my boards and everything that's going to affect my future. And I didn't grind at all, like not at all, which, you know, in that same situation,